Good morning and welcome to another edition of CCH Check Up, brought to you by Caro Community Hospital. Today we have joining us Bonnie Johnson. She is a registered dietitian, nutritionist, and diabetes educator at CCH, and she's going to be talking about National Diabetes Month. Thank you for joining us this morning, Bonnie.
I'm happy to be here.
So let's start right off. When and what is National Diabetes Month?
Well, National Diabetes Month is observed every November to draw attention to diabetes and to promote awareness of its serious effects and also focus on the importance of early diagnosis.
So what is some of the data regarding the prevalence of diabetes?
Nearly 30 million Americans are living with diabetes. 95% of those have type 2. Half of these don't know they have it. Another 86 million have prediabetes, a condition where blood glucose is higher than acceptable, but not yet high enough to meet diagnosis criteria.
So maybe somebody might not know they have it. What are symptoms of diabetes?
Symptoms are of type 2 are frequent urination, being very thirsty, tingling, pain, or numbness in the hands or feet, blurry vision, although some persons with type 2 don't have symptoms. Now, persons with type 1 have these symptoms also, but they are usually acutely ill when they are diagnosed with very high blood sugars and often unconscious. They need insulin immediately because their condition is life-threatening. Most type 1 diabetics are diagnosed in their childhood or teens, and a few in their 20s.
And what should a person with these symptoms do?
Well, they need to see immediately their health care provider, who can order the necessary tests for diagnosing this. Even if the test indicates the presence of prediabetes, steps can be taken to manage the risk for type 2 diabetes.
And how can a person get help needed to manage diabetes?
Prediabetes and diabetes education are available at Caro Community Hospital. Most Medicare and some Medicaid plans will cover the cost of diabetes education, but not prediabetes education, unfortunately. To find out if your insurance covers this, call the hospital and ask for the physician billing department. They can give you the answer. You can also visit diabetes.org or call 1-800-DIABETES, DIABETES, for information and tips on getting started in caring for your diabetes.
All right, so thank you for sharing with us some valuable information today, and again, letting us know about November being National Diabetes Month. So again, Bonnie, I want to thank you for joining us this morning. And Bonnie Johnson, registered dietitian, nutritionist, and diabetes educator at Caro Community Hospital. And as always, you can find out more information at cch-mi.org. Tune in next week for your next edition of CCH Check Up, brought to you by Caro Community Hospital.